What if I told you that this little white pill, Pioglitazone, sitting in over 2 million American medicine cabinets right now, has been quietly linked to bladder cancer in multiple studies? And here's the shocking thing. Your doctor knows this. The FDA knows this, but they're still prescribing it to seniors every single day. Are they trying to harm you? Absolutely not. The truth is far more complex and, frankly, more terrifying. Because this isn't the only pill. There are at least 6 other medications your doctor might prescribe you today that carry similar cancer risks. Pills for your heart, your blood pressure, even medications meant to prevent cancer can cause different cancers. But before you panic and flush everything down the toilet, you need to understand why doctors keep prescribing these medications. And more importantly, how to protect yourself while still staying alive. Stick with me for the next few minutes. What I'm about to show you could be the difference between making an informed decision and making a deadly mistake. Before we dive deeper, pause this video and share it with someone over 60. This is the kind of conversation they need to have with their doctor, and this could change their next appointment. The truth doctors don't always explain. When you're 75 and your heart is failing, the choice isn't between a safe pill and a dangerous one. It's between dying next month from heart failure or taking a medication that might increase your cancer risk in 10 years. Take Pioglitazone again. Studies show it increases bladder cancer risk by about 40%. Scary, right? But here's what they don't tell you. Your baseline risk of bladder cancer is only about 1 in 100, so we're talking about increasing from 1% to 1.4%. Meanwhile, uncontrolled diabetes can damage your kidneys, blind you, and even kill you within a few years. And here's a real-life example. Mr. Reynolds, 82, stayed on Pioglitazone for 6 years. His diabetes remained under control, and thanks to regular bladder monitoring, he avoided complications. For him, the calculated risk worked. This is the part most people miss. These cancer risks usually appear after 5, 10, or 15 years of use. But if you're already in your 70s or 80s, the medication might be buying you time and quality of life right now. Another familiar name, hydrochlorothiazide. If you're over 65, there's a good chance you or someone close to you takes this little water pill for blood pressure. It's cheap, effective, and widely used. But researchers have found that long-term use increases the risk of skin cancer, especially in people with fair skin who live in sunny areas. So, should doctors stop prescribing it? Here's the reality check. High blood pressure is the silent killer. It damages your arteries, your heart, your brain, and your kidneys right now, today. Meanwhile, skin cancer from this drug is often slow-growing, highly treatable, and preventable with skin checks and sun protection. Your doctor's not ignoring the risk. They are prioritizing survival today over a manageable risk tomorrow. Tamoxifen, a pill that prevents and causes cancer. Now, this one really breaks people's brains. Tamoxifen prevents breast cancer reoccurrence. It's saved hundreds of thousands of lives. But studies show that after 5 years, it doubles the risk of uterine cancer. Let's look at the numbers. Breast cancer kills about 40,000 American women every year. Uterine cancer, around 13,000. And it's often caught early. So, for many women, the trade-off is clear. Prevent a more lethal cancer, even if it means accepting a higher risk of a more treatable one. Cyclophosphamide, turning down the immune system at a cost. If you've had an organ transplant or live with a severe autoimmune disease, you might know this drug. Cyclophosphamide can increase the risk of blood and bladder cancers. But without immune suppression, that new kidney would be destroyed in weeks. Or your immune system would keep attacking your joints, organs, or nerves. Sometimes accepting one risk protects you from a certain disaster. Ranitidine, Zantac, the recalled pill some still need. This popular heartburn medication was pulled in 2020 after the FDA found that it could form a cancer-causing chemical, NDMA. But in some countries, doctors still prescribe it when other treatments fail. Why? Because untreated acid reflux can cause Barrett's esophagus, which can lead to esophageal cancer, one of the deadliest out there. In cases like these, the known devil may be safer than the unknown one. So, what should you do with all this information? I know it can feel overwhelming, but here's your 5-step action plan. Number 1, never stop medications on your own. Even well-meaning people can make deadly mistakes. I've seen strokes happen days after someone quit their blood pressure meds out of fear. Always talk to your doctor first. 2, become an informed partner in your care. The next time your doctor prescribes something, a new medication, ask these 3 specific questions. What happens if I don't take this? What are the cancer risks long-term, and how do they compare to my short-term health risks? What monitoring should we do to catch any problems early? Number 3, understand that age matters. If you're 45, a pill that might cause cancer in 15 years is a serious concern. But if you're 85, that same medication might keep you alive today. The risk calculus changes. Number 4, don't skip monitoring. Regular blood work, skin checks, imaging, these aren't optional. They are your early warning system. Number 5, stay updated. Medical science evolves. A medication that's your best option today might have a safer alternative next year. Stay in touch with your doctor and ask about new treatments periodically. And finally, remember that medical science is constantly evolving. The medication that's your best option today might have a safer alternative next year. Stay in regular contact with your doctor, especially as new treatments become available. The goal isn't to eliminate all risk. That's impossible. The goal is to make smart, informed decisions about which risks are worth taking and which ones aren't. Now, tell me in the comments, has your doctor ever explained medication risks to you like this? Your story might help someone else make a life-changing decision.